Welcome. We're very happy that you're interested in the Yale Pathways to Science. And this Public Health Day is an opportunity for me to welcome you because I'm the Dean of the Yale School of Public Health. My name is Sten Vermund. I'm a pediatrician in my first life, and then I have been doing infectious disease epidemiology. The word epidemiology is sort of the study of disease patterns in communities. So if you're sick, you want to go to a doctor or a nurse, but if your community has a major problem, you might want an epidemiologist. The COVID-19 problem that we're facing now is an example of where you need both. You need somebody who is going to take care of the sick patients, and you're going to need somebody who intervenes at the community level. So, what is a dean? A dean is the chief administrative officer of a school. We have 14 schools at Yale, and the School of Public Health is one of them. So, I'm responsible for assisting the faculty and the staff to meet the needs of the students, nurture the research in the school, and provide a platform for the service that we do to the local and global communities. My own background has been in, as I mentioned, infectious disease research and control and prevention. I've worked on tropical parasitic diseases. One of them is malaria, and you've probably heard about that, spread by mosquitoes. Another one you probably haven't heard of is schistosomiasis, which is actually spread with snails as a host. And water. I have also worked on human papillomavirus, which causes cervical cancer, and we have a good new vaccine for that now. And I've worked a lot on the theme of HIV and AIDS. So I wanted to just share with you what drew me to public health. I was practicing pediatrics in New York City, and I saw so many social causes of disease. A child who would fall out of a window because there wasn't a window guard. A child who was hit by a car because there wasn't a proper crosswalk, or someone ran a red light and that person had a drinking problem. I saw child abuse. I saw children who had infectious diseases that were completely preventable, but that particular child had not been vaccinated for one reason or another. I saw diseases of immigrant children who had come straight from the Dominican Republic, which was the community that I was working in Washington Heights in Manhattan. You may have heard of the Broadway play Into the Heights, which is all about the culture of Washington Heights in northern Manhattan. And so I just got more and more interested in prevention and how to avoid diseases rather than always trying to cure them. How can we prevent them? And I learned a little bit about tropical medicine and the problems of developing countries, low and middle income countries. So I ended up going back to school after I finished my pediatrics and doing public health training. And then after my public health training, which was sort of more general, I also went back to school again and did a doctoral degree in epidemiology. So I could really do a deep dive into the field of public health and prevention. So that's what I find most exciting about public health is prevention. For many years, we have been predicting that the globe is at high risk of a pandemic respiratory viral illness. We thought it might be influenza. That would be the most problematic. And we have had global spread of influenza. Some of the strains have been especially dangerous for humans. And then we've also predicted the rise of zoonotic diseases. What's a zoonosis? Is like zoo, coming from animals. So a zoonosis is a disease that's transmitted from vertebrate animals to humankind. And Why do we predict more zoonotic diseases? Because the global population is higher than it's ever been in the history of the planet. When I was born back in the 1950s, there were 2.4 billion people on Earth. Today, there are 7.7 billion people on Earth. So that's just in my lifetime. And the more people you have, the more rainforest you cut down, the closer you come to the natural world, and the more likely you are to have a leap of a virus from animal populations into humans. That's exactly what happened with HIV, which was originally in the great apes and leapt into humans, probably related to hunting of apes. That's what's happened to the coronavirus. So learning more about how do we prevent overpopulation of the world, how do we preserve rainforests, how do we stem climate change, how do we avoid the coronaviruses of the future, that's what really makes me excited. Now, there's a very diverse group of topics in public health. We have epidemiologists like myself. We have biostatisticians. Those of you who are especially good at math can take your math skills and apply them to public health. We have social and behavioral sciences. How do we change people's behavior? How do we help them make the best choices for their own health and the health of their families, health of their community? We also have health policy and health management. So how do you manage the health system? How do you make the proper policies to nurture health for society? And then we also have environmental health sciences, which is really looking at the natural world and how we can preserve the integrity of our planet without pollution and without global warming. There are also cross-cutting issues like maternal and child health, global health, nutrition, and others in our discipline of public health. So you see, it differs a little bit from medicine, from nursing, where you have surgery, you have pediatrics, you have internal medicine, you have obstetrics, you have gynecology, different disciplines that have to do with patient care. We're really thinking from a community perspective. Now, this is a special year where we're celebrating the 50th year where women attended Yale undergraduate and the 150th year of women at Yale University in the graduate schools. And it's very important that we highlight the diverse cohort of public health leaders around the world who are women. And that's what we're doing. If you get a chance to come over to the School of Public Health building someday, not when we're in the middle of a COVID lockdown, but you'll see a display outside my office when you walk into the building at 60 College Street. You'll see that we've been highlighting women graduates and leaders of our school. So thanks for participating today. It's great to have diverse backgrounds at this stage of your lives, learn a little bit about a lot of things that will help you decide what you want to do in the future, and also give you a stronger background to apply to whatever specialty topic you pick as a career. Think about careers in public health. I find public health to be endlessly interesting, and I never am upset about a Monday morning because I like to work. I like my job, and I like what I do for a living. So if you love your job, you're now going to spend much of your life doing what you love. We do think that at the end of the day, we do make a difference in public health. Each and every day, we're trying to save lives, thousands and tens of thousands and even millions at a time. So welcome to studying the most pressing problems in health of our day, and enjoy your session and enjoy your day. Thanks so much. Bye.